Feeling like things aren't quite working like they used to in certain areas of your life? Maybe you've noticed a change, a difference, something that just feels off. It can be frustrating, even a little disheartening, when you're not experiencing the intimacy and connection you desire. It's a topic that many men find difficult to talk about, something that can feel isolating. You might wonder why, what's changed, or if it's just a natural part of getting older. And while age is a factor in many things, sometimes the reasons behind these changes are much closer than you think, hidden in plain sight. What if I told you that something you're doing right now, something you rely on for your health, could actually be standing in the way of your intimacy? It's a painful reality that many men face, often without realizing the connection. The truth is, certain common medications, ones prescribed by doctors to help you manage other health conditions, can have unintended side effects that impact your ability to achieve or maintain an erection. It's not something doctors always flag clearly, or maybe you didn't connect the dots yourself. But understanding this link is the first step to finding solutions and regaining that important part of your life. In this video, we're going to lift the veil on this often overlooked issue. We'll explore 5 common types of medications that could be negatively impacting your erectile function without you even knowing it. This isn't about stopping medication. Absolutely not. It's about becoming aware and empowered to have informed conversations with your doctor. Because you deserve to understand your body and your health fully, and you deserve to live life to the fullest, including maintaining healthy, intimate relationships. It's a sensitive topic, I know, but staying informed is crucial. Stick with me to the end, because knowing about these potential culprits might just open the door to finding effective solutions. And there's something I'll share that might truly surprise you about how manageable this can be. Let's start with the first major group of medications that can sometimes throw a wrench in things when it comes to erectile function. These are medications commonly prescribed for conditions that become more prevalent as we get older, specifically issues with the heart and blood pressure. Now, many people, especially those over 60, are taking medication to keep their blood pressure in check, and that's incredibly important for preventing heart attack and stroke. Likewise, some are on medications to manage heart conditions like angina or irregular heartbeats. 2 specific types of these medications often come up in discussions about erectile difficulties: beta blockers and diuretics, sometimes called water pills. Let's take beta blockers first. These medications work by blocking the effects of adrenaline, slowing down your heart rate and relaxing blood vessels, which lowers blood pressure and reduces the heart's workload. Sounds good, right? And for your heart health, they are often life-saving. However, achieving and maintaining an erection requires healthy blood flow. It's a hydraulic process, essentially, where blood needs to rush into the penis and be held there. Beta blockers, by generally reducing blood flow and sometimes affecting nerve signals, can potentially interfere with this process. They can reduce the sensitivity of the nerves involved in arousal and also make it harder for enough blood to flow to the penis to achieve firmness. It's important to understand that not everyone taking a beta blocker will experience this side effect. Some people have no issues whatsoever. But for others, it can be a significant factor. The impact can range from difficulty getting an erection at all to being able to get one but not maintain it, or even experiencing a reduction in sexual desire. It varies greatly from person to person. If you started a beta blocker and noticed changes in your erectile function afterward, it's definitely something to bring up with your doctor. They might be able to adjust the dose, switch you to a different type of beta blocker that has less of an impact on sexual function, or even explore a completely different class of blood pressure medication. There are many options out there, and what works best for your heart and your quality of life is the goal. Moving on to diuretics, or water pills. These medications are also widely used to treat high blood pressure, as well as conditions like heart failure and swelling. They work by helping your body get rid of excess salt and water through urine. This reduces the volume of fluid in your blood vessels, which in turn lowers blood pressure. Like beta blockers, diuretics are vital for managing serious health issues. However, by reducing overall fluid volume and potentially affecting blood flow and electrolyte balance, some diuretics, particularly the older, thiazide-type diuretics at higher doses, have been linked to erectile dysfunction. The exact mechanism isn't always perfectly clear, but it's thought to involve changes in blood flow dynamics and potentially affecting nerve signals or even hormone levels to some extent. Again, this isn't a guaranteed side effect for everyone. Many men take diuretics with no impact on their sexual health. But if you're on a diuretic and have noticed difficulties with erections, it's another potential piece of the puzzle. The good news is that, like with beta blockers, there are often alternatives or adjustments available. Sometimes lowering the dose if possible, switching to a different type of diuretic, or trying a different class of blood pressure medication altogether can resolve the issue. Your doctor will weigh the benefits of the medication against the side effects you're experiencing and work with you to find the best plan. It's crucial not to stop taking these medications on your own, because they are managing serious health conditions that could become dangerous if left untreated. But having an open conversation with your healthcare provider about how you're feeling and the specific side effects you're noticing is incredibly important. They are there to help you manage your health in a way that supports your overall well-being, and that includes your sexual health. Sometimes, just knowing that the medication could be the cause can alleviate a lot of stress and worry, allowing you to focus on finding a solution with your doctor's guidance. Don't dismiss changes in your sexual function as just an inevitable part of aging. While age plays a role, it might also be something reversible or manageable with a simple medication adjustment. These medications, the beta blockers and diuretics, are just two examples within the broad category of cardiovascular drugs that can sometimes have this impact. Understanding this potential link is the first step in addressing it proactively with your doctor. It's about taking control and ensuring your treatment plan supports all aspects of your health and happiness. Now that we've looked at two common types of blood pressure and heart medications, let's move on to another very widely used class of drugs that can also unfortunately impact erectile function for some men. Moving on from the cardiovascular medications, another very common type of medication that can interfere with erectile function is something many people take for their mental health. I'm talking about antidepressants. In today's world, unfortunately, anxiety and depression are widespread, and antidepressant medications have helped countless people manage these conditions and improve their quality of life. However, certain types of antidepressants, particularly the selective serotonin reuptake inhibitors, or SSRIs, are well known for having sexual side effects, including difficulty achieving erections, reduced libido, delayed or absent ejaculation, and difficulty reaching orgasm. SSRIs work by increasing levels of serotonin in the brain, which helps improve mood and reduce anxiety. Serotonin is a neurotransmitter that plays a role in many bodily functions, including mood, sleep, and yes, sexual function. By altering serotonin levels, these medications can dampen the complex physiological and psychological processes involved in sexual response. It's a frustrating side effect, because the medication might be doing wonders for your mood and mental well-being, but at the same time, it's creating difficulties in your intimate life. And intimacy is an important part of overall well-being, especially as we get older and relationships become even more central to our happiness. The impact of SSRIs on sexual function can be quite pronounced for some individuals. It's one of the most commonly reported side effects. And it's not just SSRIs. Other types of antidepressants, like SNRIs, serotonin, norepinephrine reuptake inhibitors, and even some older tricyclic antidepressants can also cause similar issues. The good news is that not all antidepressants have the same degree of sexual side effects. Some, like bupropion, Wellbutrin, are often considered to have fewer sexual side effects, and in some cases might even be used to counteract the sexual side effects of other antidepressants. If you are taking an antidepressant and are experiencing difficulties with erections or other aspects of your sexual function, this is absolutely something you should discuss with the prescribing doctor, whether it's your primary care physician or a psychiatrist. They are aware of these potential side effects and have strategies to manage them. This could involve adjusting the dose, switching you to a different antidepressant that is less likely to cause sexual side effects, or adding another medication to help counteract the side effect. Sometimes, timing the dose differently might help for certain medications. It's about finding the right balance for your mental health and your sexual health. You shouldn't have to sacrifice one for the other if there are viable alternatives or solutions available. Openly communicating with your doctor about these side effects is key. They need to know the full picture of how the medication is affecting you to provide the best care. Remember, mental health is crucial, but so is the quality of your intimate relationships. Don't feel embarrassed or hesitant to bring this up. It's a legitimate medical concern. Another group of medications that can sometimes impact erectile function are those used to treat enlarged prostate, a very common condition in older men called benign prostatic hyperplasia, or BPH. As the prostate gland grows, it can press on the urethra, causing bothersome urinary symptoms like a weak stream, frequent urination, or difficulty starting or stopping urination. Medications are often the first line of treatment for these symptoms. Two common classes of medications for BPH are alpha blockers and 5-alpha reductase inhibitors. Alpha blockers work by relaxing the muscles in the prostate and bladder neck, which makes it easier to urinate, while generally not as strongly linked to erectile dysfunction as some other medication types. Some alpha blockers can occasionally cause issues with ejaculation, retrograde ejaculation, where semen goes into the bladder instead of out the penis, and sometimes, though less commonly, can impact erections, potentially by affecting the nerve signals involved or causing dizziness, which impacts mood and function. 5-alpha reductase inhibitors, such as finasteride and dutasteride, work differently. They shrink the prostate gland by blocking the conversion of testosterone to dihydrotestosterone, DHT, a hormone that contributes to prostate growth. While effective at reducing prostate size and improving urinary symptoms, these medications directly impact hormone levels. Since testosterone is a key hormone for sexual desire and function, reducing DHT can sometimes lead to decreased libido, difficulty achieving erections, and ejaculation problems. For some men, these side effects are minimal or non-existent, but for others, they can be significant and bothersome. If you're taking medication for an enlarged prostate and have noticed changes in your sexual function, it's worth discussing with your urologist or primary doctor. They might explore if a different type of BPH medication could work for you, or discuss other treatment options for BPH that don't involve these types of medications. They might also investigate if the urinary symptoms themselves were already impacting your sexual function due to discomfort or anxiety. It's a conversation about weighing the benefits of symptom relief against the potential impact on your sexual health. There are different alpha blockers, and they can have varying effects on individuals. Similarly, the degree to which 5-alpha reductase inhibitors impact sexual function varies. Your doctor can help determine if your medication is likely contributing to your difficulties and what alternatives might be suitable for you. Don't assume that because a medication is helping your urinary symptoms, you have to accept negative sexual side effects. There might be other ways to manage your BPH that have less impact on your intimacy. Open communication is essential here, just as it is with the other medication types we've discussed. Next, let's consider a class of medications that many people use, sometimes without even thinking of them as potent drugs. Antihistamines. We often reach for antihistamines to relieve allergy symptoms like sneezing, itching, and a runny nose, or sometimes even for sleep because they can cause drowsiness. However, some types of antihistamines, particularly the older, first-generation ones like diphenhydramine, found in products like Benadryl, and chlorpheniramine, work by blocking the effects of histamine, which is involved in allergic reactions. But histamine also plays a role in other bodily functions, including nerve signaling and blood flow. By blocking histamine, these older antihistamines can have anticholinergic effects, meaning they block the action of acetylcholine, a neurotransmitter involved in many bodily functions, including muscle contraction, nerve signals, and yes, sexual arousal and function. These anticholinergic effects can dry up secretions, which helps with runny noses, but can also potentially impair nerve signals required for erection and reduce blood flow to the penis. Newer, second-generation antihistamines like loratadine, Claritin, and cetirizine, Zyrtec, are much less likely to cause these side effects because they are less likely to cross the blood-brain barrier and affect systems outside of just blocking histamine peripherally. So, if you're regularly taking an older type of antihistamine, either for allergies or as a sleep aid, and are experiencing issues with erections, it's worth considering if this could be contributing. While often available over the counter, these are still medications that can have significant effects on the body. Discussing your allergy treatment or sleep aids with your doctor or pharmacist is a good idea. They can recommend alternative antihistamines that are less likely to cause sexual side effects, or explore other strategies for managing your allergies or improving your sleep that don't involve anticholinergic medications. It's easy to overlook over-the-counter medications as potential culprits, but they absolutely can have side effects and anticholinergic effects, which include dry mouth, constipation, confusion, especially in older adults, and yes, potential erectile dysfunction, are known side effects of many older antihistamines and certain other medications with similar properties. Being mindful of all the medications you take, including over-the-counter ones, is important when trying to identify the cause of sexual difficulties. Finally, let's touch upon a group of medications often used for pain management, particularly stronger pain relievers like opioids. Opioid medications are powerful pain relievers often prescribed for moderate to severe pain, such as after surgery, injury, or for chronic pain conditions. They work by binding to opioid receptors in the brain and body, which reduces the sensation of pain. However, opioid use, especially long-term use, can have a significant impact on hormone levels, particularly reducing testosterone production. As we discussed earlier in the context of prostate medications, testosterone is vital for sexual desire and function. Low testosterone, a condition known as hypogonadism, is a common side effect of chronic opioid therapy and can lead to reduced libido, difficulty achieving or maintaining erections, fatigue, and other symptoms. Opioids can also directly affect the nervous system and psychological state, which can further impair sexual function. The relationship between chronic pain itself and sexual function is complex. Pain can certainly reduce desire and make physical intimacy difficult. However, the medication used to treat the pain can also be a direct cause of sexual dysfunction through hormonal effects and other mechanisms. If you are on chronic opioid therapy for pain and are experiencing difficulties with your sexual function, this is definitely something to discuss with your pain specialist or primary care doctor. They can check your hormone levels, particularly testosterone. If low testosterone is identified, there might be options for testosterone replacement therapy, although this needs careful consideration and monitoring. More importantly, your doctor can explore alternative pain management strategies that might allow you to reduce your reliance on opioids or switch to different types of pain relievers that have less impact on hormone levels and sexual function. Managing chronic pain is essential for quality of life, but it's also important to address side effects that impact other areas of your life, like intimacy. Don't just accept erectile dysfunction as an unavoidable consequence of pain management if you're on opioids. There may be strategies to mitigate this side effect while still effectively managing your pain. This is another situation where open and honest communication with your healthcare provider is paramount. They can help you weigh the benefits and risks of your current pain management plan and explore ways to improve your overall quality of life, including your sexual health. Understanding that these medications, from blood pressure pills and antidepressants to prostate treatments, antihistamines and pain relievers, can all potentially impact erectile function is the first step in finding solutions. It's not about blaming the medication or your doctor. It's about recognizing a potential connection and taking proactive steps to address it with professional guidance. So, we've talked about how certain common medications used for blood pressure and heart issues, for depression and anxiety, for enlarged prostate, for allergies, and for pain could potentially be affecting your ability to get and maintain an erection. We discussed how things like beta blockers and diuretics can impact blood flow, how antidepressants like SSRIs can alter brain chemistry related to desire and response, how prostate medications like 5-alpha reductase inhibitors can affect hormones, how older antihistamines can interfere with nerve signals, and how opioids can lower testosterone. It might feel a little overwhelming to think that medications meant to help you are causing another problem, but please don't feel discouraged or helpless. This knowledge is powerful because it means you can do something about it. Remember, the key takeaway from all of this is the importance of talking to your doctor. You should absolutely never stop taking any prescribed medication without consulting your healthcare provider first. These medications are managing serious health conditions that need careful attention. But if you are experiencing difficulties with erectile function and you're taking any of these types of medications, or frankly, any medication at all, it's a crucial conversation to have with your doctor. They are the experts who can assess your individual situation, review your full medication list, and determine if a medication is likely contributing to the issue. They can then discuss potential strategies, which might include adjusting the dose of your current medication, switching you to a different medication within the same class that has fewer sexual side effects, or trying a completely different class of medication to manage your underlying condition. They can also explore other treatment options for erectile dysfunction itself, like medications specifically designed for ED, like sildenafil or tadalafil vacuum erection devices, or other therapies, which might be used in conjunction with your current medications or after making adjustments. The surprising thing I wanted to share with you is just how common this is, and how often a simple conversation and a potential medication adjustment can make a world of difference. Many men suffer in silence, feeling embarrassed or thinking it's just age, when the solution might be as straightforward as working with their doctor to fine-tune their treatment plan. Your doctor wants you to have the best possible quality of life, and that includes a healthy and satisfying intimate life. Bringing up this topic is not trivial. It's a vital part of your overall health and well-being. So, take this information and use it as a prompt to open that dialogue. Prepare by making a list of all the medications you take, including over-the-counter drugs, supplements, and even herbal remedies. Note when you started noticing the changes in your erectile function relative to starting any new medication or changing a dose. This information will be helpful for your doctor. Be open and honest about what you're experiencing. There's nothing to be ashamed of. This is a common side effect of many necessary medications, and healthcare professionals are trained to help you navigate it. Remember, small changes and open communication can indeed make a big difference to your health, your happiness, and your relationships. You have the right to feel good and to enjoy all aspects of your life as you get older. Don't let potential medication side effects be a barrier you accept without exploring solutions. Take action today by scheduling that conversation with your doctor. If you found this information helpful, please let me know by giving this video a thumbs up. It really helps us know what content is valuable to you. And if you have experiences with medication side effects you're comfortable sharing, please leave a comment below. Hearing from others can be incredibly supportive for this community. Don't forget to subscribe to the channel and hit the notification bell so you don't miss out on future videos packed with information to help you live your best life at every age. You are in control of advocating for your health, and understanding potential medication impacts is a huge step in that direction. Keep taking care of yourself, stay informed, and work with your healthcare team to ensure you're living life to the fullest.